Good morning. Good morning, everyone. Thank you for joining us for our last day of Health is Wellness Week. Good morning, good morning, good morning, world. Tuning in from the West Coast, it's 9 a.m. If you are on the East Coast, it is noon. And we thank you for joining us today, my lovely co host, the Canamedic. Thank you for being
Good
here, sir.
morning.
I
Good morning,
appreciate
Nicole.
thank you. Good morning to you. I really appreciate you hanging with me all week. It has been quite a ride. We've learned so much together. I'm so grateful that you could be here with me for this particular week, just in general, because you've been so great at being able to explain to us how these autoimmune disorders really work and put it into layman's terms so anybody can understand. So I really appreciate you taking the time out of your very busy schedule, our vice president of hemp, and the Canamedic. I know you have a lot on your plate, and so thank you again so much for being here for this week with me.
It's been a pleasure.
Yeah, for sure, it has been fun. I want to jump in so we can get started today and talk about our last topic of discussion. Our last autoimmune disorder that we're going to be discussing today is called fibromyalgia. For individuals that do not know what fibromyalgia is, it is an autoimmune disorder and is a common syndrome of chronic pain. That has been a recurring theme throughout our week with people with autoimmune disorders, even sickle cell, is this immense pain that is immeasurable and that opioids just don't work for. But that is the most common. Opioids and steroids are the most common prescribed medications and synthetic treatments that are given for these autoimmune disorders. Um, Fibromyalgia is 2%, 2 to 8% of the entire population. I collected this information from the Journal of Clinical Medicine. So if you wanted to look it up, you can. And it is the most common reason for generalized pain among working age women worldwide. Did not know that. Therapy for fibromyalgia is challenging and based on a multidisciplinary approach. Um, Patients may respond with pharmacological treatment, um, inhibitors, reuptake inhibitors, and anticonvulsants. Because I guess convulsing is a common symptom of fibromyalgia. Um, Medical cannabis represents a promising therapeutic option for fibromyalgia patients due to its effectiveness and relatively low rate of serious adverse effects. Although the identification of cannabinoid receptors and their endogenous ligands has triggered a large body of studies, there is a paucity of large scale and prospective clinical trials regarding their role in fibromyalgia. So this is very promising. And I just want to read to you really quick what Project CBD says. So if you're not familiar with Project CBD, they are a very reliable, excuse me, very research-based organization. You could find them at projectcbd.org or .com. And a recent study published in Clinical and Experimental Rheumatology that demonstrated that cannabis can be used effectively to remedy these problems, at least by some patients. Generally, cannabis research is rife with methodical difficulties thanks to regulations that deem marijuana more dangerous than fentanyl or Oxycontin. But this study by Italian scientists stands out, producing research that is applicable to people who are trying to use medical cannabis to treat fibromyalgia. One of the facts that I want to read before we kind of get started, and I allow my co-host to give us a more understandable explanation. Given the intensity of the drugs people were already taking, it was astounding to find that half of patients, 47% of those patients, got enough relief from cannabis to reduce or cease their painkiller usage. That's amazing. Almost half. And that was just based on one study. So For those of you who don't understand these big medical terms, I think Stanley has a much easier explanation of what fibromyalgia is and how it affects some of the most common symptoms that people suffer from.
Yes, thank you, Nicole. And good thing about that information that you provided is that at least they're using CBD and cannabis-based products as an alternative, because we know a lot of patients suffering from fibromyalgia have a plethora of pills. And I'm going to go really technical for a second, and then we're going to go literal for a second. So the technical definition of fibromyalgia is a medical condition characterized by chronic and widespread pain, and it was often heightened by pressure. Other symptoms include tiredness to a degree normal activities are affected, sleep disorders, cognitive dysfunction, and also a lot of patients report restless leg syndrome. So if you see someone whose legs bouncing, oftentimes those patients, that's one of the side effects of fibromyalgia, including their bowels and bladder problems. But one of the primary things is the numbness and the tingling. So a way to break this down is it's a central nervous system. One thing we've learned this week when dealing with autoimmune diseases is that anything that affects the central nervous system causes a different type of pain. So I'm going to explain it like this. If you fell and broke your arm, you would probably take some type of opioid or pain reliever or some type of analgesic to relieve that pain. And the reason these medications work is because that injury is what we call musculoskeletal, which means it affects the muscles and the bone of the skeleton. The problem with these autoimmune diseases and the pain associated with different autoimmune diseases is that it's pain of the nerve. So when people have that burning sensation or that painful sensation, they're taking the opioids or they're taking the pain relievers, they're realizing like it's not touching it. That's the main thing that you hear a lot of patients say, oh, it's not touching it. So imagine if you have fibromyalgia, these patients oftentimes, if you take your thumb and just press on them, it's systemic. It feels like there's fire and lightning going through their cells. And I know people with fibromyalgia, and one of the other primary focuses of the pain is in the legs. So the legs, the lower periphery, what we call the periphery, which is the outside parts of the body, the legs, the feet, the knees, the ankle. And it, as Nicole stated, it does affect more women than men. And it's usually in the middle age. And this is a long-term diagnosis also, ladies and gentlemen. So when a person is diagnosed with fibromyalgia, it's not like being diagnosed with the flu or a rash or something like that. This is long-term and it's systemic. And because it's affecting the nerves, it's a lot more difficult for those people to find relief and mitigate the pain, which is why, again, medical cannabis could potentially be a healthy therapeutic alternative, because we know with the CB1 and CB2 and other receptors in our body, the proteins of the cannabis and our cannabinoid receptors, many of them affect the central nervous system, as we stated yesterday with multiple sclerosis, how cannabis potentially helps heal that myelin sheath. Well, your nerves, that same sheath is on the same nerves. So the central nervous system, everybody's just the same. Now, everybody doesn't respond the same, but again, we're talking about the effect on the actual nerve. So ladies and gentlemen, tune in because we've got some great guests for you today. And Nicole, when you're ready, let's take a dive and bring our guests in.
For sure. I want to first introduce the lovely Dr. Tanya Adams. She is a current member of M4MM. She is co-chair of Doctors for Cannabis Regulation, the New York Committee, and is the founder of the Primary Medical Care. I'm not going to attempt to say that name.
Talk it.
There it is.
Talk it. Good Native American name.
Good Native American name.
Yeah.
And that is a concierge of family medicine and lifestyle medicine practice on the North Shore of Long Island. Dr. Adams is an early adopter of medical marijuana and has been recommending cannabis for patients since the inception of New York's medical program in 2016. Thank you so much, Dr. Adams, for being here. We really appreciate it.
Oh, thank you so much for having me.
Yes.
I'm excited to get started. So, yes, I am a family practitioner, and I also have a board certification in lifestyle medicine. Most people know what family medicine is, but lifestyle medicine is a relatively new board certification, and uses Western-based data-driven information to help treat, prevent, and cure certain chronic diseases when it makes sense. But we can also manage many conditions and optimize patients' health using lifestyle medicine. And it's a very common sense approach to healing the body. So there's 6 tenets of lifestyle medicine. We have diet is the number one, and we advocate mainly for a whole food, plant-based, low-fat diet. Exercise is the second. Then we have mental health, which is, we all know, very important. Addictions, connectivity, connectedness, and I think I said, did I say exercise? Hope I didn't miss one. Okay, so those are the 6 tenets of lifestyle medicine. And we can really change patients' lives. I can't change patients' lives. Patients can change their own lives. It's empowering for them to change their lives with this information that I can help deliver for them. So that's, I see myself as a guide, and I'm helping patients optimize their life. And if we can use lifestyle instead of medications, that's great. But you know what? We need our medications sometimes too. So we have all the tools in the tool belt available to us when I'm treating patients, and we try and maximize the lifestyle first. So that's like our first line of treatment. And then we'll go to medications if necessary.
That's amazing, Dr. Adams. I'm so grateful that thank you for explaining what lifestyle medicine is, because I did not know. And I'm so glad that the first thing you mentioned was diet and a plant-based diet, a nutrition-focused whole food diet. Because our other guest today, Chef Nico, he created a book. He wrote a book called Nutrition Fit, Only the Strong Survive. And I will let Chef Nico introduce himself and explain a little bit about what he does when it comes to understanding what is the best plant-based diet or plant-based lifestyle for the clients that he also helps and manage their symptoms. So Chef Nico, please introduce yourself. Welcome to the show.
Thank you. Greetings. Good afternoon to everybody. It's a pleasure to be on this platform sharing all of this knowledge. As you know, my name is Chef Nico. I am an author, and as a profession, I am a nutritional coach and consultant for over 26 years. I help CEOs and entrepreneurs live a more healthy life, balancing that through food plans and nutrition by charting where plant-based electrical food elements want to go, lay over, or settle in the mind and body of the human structure. This will give us performance on a level that is supported by what the doctor said, a lifestyle. It is an important thing to understand that food is always going to be a part of our lifestyle. So we embrace that. We understand some of the electrical conductivity in that manner, and we'll do a deep dive on that as we go into it.
Thank you so much, Chef Nico, for being here. Stanley, want to get us started with our questions here for our lovely panel of guests?
Absolutely. So 2 things that we've heard already. So if you're watching this, make sure you tag someone, share this video, or even send it in a messenger, because the information provided today, you never know who it may help. You never know who's suffering from what. And the first thing that really stands out to me from Dr. Adams and Chef Nico, we've heard that D word that we've heard multiple times this week, and that is diet. So Dr. Adams, if a patient came to you and said, hey, I think I'm having all of this pain, I'm taking all of these pills, nothing is working, at what point would you ask them about their diet? Because we know that diet is important, and many patients don't live the best dietary lifestyles. So what would you say to a patient that's coming to you saying, I'm displaying all of these symptoms? At what point would diet come into your diagnosis, into your conversation when doing your exam?
Well, before an exam even happens, almost 90% or more can be diagnosed based on history alone. So it's very important to take a good history from a patient. And, patients coming in, depending on their complaint, diet's usually going to be an important topic that we need to discuss. It affects everything. We are what we eat. So it's very important to address diet. So that usually comes up in my office pretty much most visits, I would say. We do discuss diet. My patients are sometimes, that's Dr. Adams. I know, low fat, plant based, whole food, but that's a challenge for some people. And when one of the things that we talk about with lifestyle medicine is patients get more out of making drastic changes than they do by making small incremental changes. So that sounds scary to some people when they first come in. So they really do have to have an understanding. It takes a while to get a patient on board a lot of the time before they really can get a grasp on what does this mean? Like, if I want to feel better, I have to do better. I have to change things in my life. And it's interesting to see that patients actually continue with those changes, maintain those changes when they get benefit from them. So small incremental changes sometimes don't produce enough benefit. If you just you stop eating a little bit of carbs and you cut down on some, and carbs are not a bad thing. I also want to say carbs are our friends. Plants are carbs. The thing that we want to avoid is processed carbs. So it's very important. I tell patients that we live on carbs and we need to eat our fruits and vegetables. And really, we don't need all this protein. We have this crazy idea about protein in this country, about how much protein a human might need. So we have to demystify some of what it means to follow a plant-based diet and the healthfulness of a plant-based diet. But what I do see in clinical practice, though, is the patients that I can explain this to and they embrace it and they go home and they try it, they continue because they feel better. And I encourage them to look, when they're making food choices, before they even put the food in their mouth, think about how that food's going to make you feel. It's so obvious to people who eat a healthy lifestyle, but people who don't eat healthfully, they don't really think about food that way. Food is just something that feels good. They're hungry. They're in a hurry. They got to eat. So if they really think about how that food is going to make them feel, they might make different choices. So your relationship with food, patients' relationships with food can change. And it's just really shifting the thought process that is sustenance, and this food is going to make me feel either healthful and good, and it's going to promote my health, or or maybe not. It could be neutral or it could be detrimental. So we talk about reinforcing those changes, and big lifestyle changes sometimes make the biggest difference, and usually those patients are more likely to continue with those changes.
Thank you so much for that. I know you got something, Nicole, but this ties directly into this week. So out of all these episodes this week, I've been getting a lot of great feedback, and I was reached out to by a patient yesterday and we were talking, and they're anemic. And I was telling them about the episode from Chef Nico on last Saturday. I advised them to go back and watch it because I told them those incremental changes add up to the monumental changes. And the patient told me verbatim, I don't want to do that. I don't want to change my diet. I can't change my diet. I'm not ready to do it. I'd rather take the pills. So ladies and gentlemen, it's coming directly from the source here today. So thank you so much for that.
And sometimes I give them pills too, I have to say. So sometimes I give them, I do have some tools in my tool belt that I can use to help patients have a better outcome. So sometimes we combine pills with lifestyle changes, and that isn't all bad for those people because they do need some extra help, and it is hard. And I personally have made lifestyle changes for myself, and I've been down that road. I know how hard it is, and it does take a level of commitment. But there are ways to sometimes lead the patient down that road. But anyway, so that takes more work than one conversation.
Dr. Adams, thank you for that. I am a living, walking testimony to those individuals that find it hard to make that transition. And you're absolutely right. Not everyone is willing or able to do so. When I got diagnosed with HIV 4 years ago, the first thing that I knew, because I understood Dr. Sebi's teachings, was that the only way I was going to heal my body was a plant-based diet, right? And I knew that. And so I prepared myself. I went to Trinidad for a month, and I decided I was going to eat everything that my auntie cooked for me that month. I knew that when I got back from Trinidad that I was going to have to start changing my lifestyle to accommodate this plant-based lifestyle. And the pandemic was my real live awakening. That truly was my awakening. And knowing that because I have a compromised immune system, I can choose to stay on this medication for the rest of my life, or I can choose to in the words of Chef Nico, allow the body to absorb the virus by eating the right foods. And now that I'm involved with his program, him, excuse me, as a nutritional coach, helping me through the process and the steps that I need to take. And I recommend everybody get a nutritional coach because it's not easy. It's much research that I've done on my own. Understanding nutrition is a science. It's medicine. And when you get down to what foods exactly you need to be eating for your body type, it gets a little tricky. And so I know that Chef Nico is ready to respond about what kind of things, small changes that you can make in your everyday lifestyle that the average person might not think about, to help them get into this new lifestyle that will help them get off pharmaceutical drugs, that will help reverse the effects of whatever debilitating disease they might be suffering from. And so can you share with us, Chef Nico, a couple of those pointers that you mentioned, the anti-inflammatory, the 5 antis that you mentioned to us on Saturday, and the plants that have those 5 antis that we can implement into our daily routine right now, something simple.
Absolutely. Key reason why I stated food plan. First thing that we all must understand in our life is that most of us are professionals, whether we're just starting or we've been in this for a while. So a lot of these autoimmune diseases have to be woven into our everyday grab and go life. If our mindset is not set for a growth mindset, you're not helping out the experts that are involved in your life, and you're definitely not helping yourself out. So what do I mean by a growth mindset? I remove the language diet. It has a trigger system to 90% of the population. I place food plans in front of people because the word plan now triggers more of the professional, organized, structured side of us, taking away some of those triggers. Like Stanley said, I am not changing my diet. Good, that's great. We're free of focusing on the diet. We're focusing on the food plan that can coexist and create synergy between what is going on. So specifically speaking about fibromyalgia, when you do the data and research, if anybody were to search for this, you realize there's no knowledge on it. Nobody really knows how it happens and what causes it. That leaves you in a sticky situation when you're trying to understand, what can I do for myself? What are some of the simple in-home solutions that I can do for me while I have a clinician space researching what this situation is? So through plant-based data and research, there is 2 important things that we'll cover real quick. One of them are adaptogen herbs. Now, there's a variety of adaptogen herbs. Within adaptogen herbs, you have 5 key elements, and I'll highlight one. I'm a big promoter of rosemary water. This is just simple rosemary. We'll go into the importance of that right now. Rosemary is an adaptogen herb holding 5 elements: antiviral, antibacterial, antidepressant, anti-inflammatory, and this little piggy that went to market is, and it balances every human hormone. All of this can happen at the same time by doing a simple in-home infusion by just putting a stem of rosemary into the water. Scientifically, anything that bonds for more than 3 seconds, or anything that's touching for more than 3 seconds, begins to bond. You let that happen for 24 hours, and then you just remove the rosemary. That now leaves the water infused with those 5 elements that I just said. Every time you 5 of those elements are going into your body, allowing you to do more. This is not the final solution, but as all clinician spaces know and nutritional coaches know, it is the paths of logic. You have to have multiple valuable avenues that are reaching the same goals. Why? Because, well, we're talking, myself, I speak of electrical conductivity. How much raw value of electrical conductivity are you placing into your body, especially when we're talking about fibromyalgia, which connects with all of the nerve receptors, and that can go from all parts of the body. Do a little deep dive on that later on, but that is a looking glass into a very important do-it-yourself in-home solution while you are waiting for other passive solutions.
Simple. Rosemary water. Dr. Adams, can you explain to us a little bit, with autoimmunes, it's different tests, right? We've been talking about it all week. What is the test that determines whether or not you have lupus versus fibromyalgia or rheumatoid arthritis? And they varied from, nuclear and cell testing and all these things, but really it was the symptoms. Once you have that certain blood test and then you match the symptoms with that blood test, that determines which one of these autoimmune disorders you might have, because our research also shows that there's over 80 different types of autoimmune disorders. So can you share with us, based on your experience, what is the most common thread in your fibromyalgia patients? And normally, how long does it take them to get an actual diagnosis of fibromyalgia?
Yeah. Well, fibromyalgia is a challenging one. And the most common symptom is pain.
Right.
Pain pain that's difficult to diagnose. By nature, fibromyalgia is difficult to diagnose. And that is because fibromyalgia is actually a diagnosis of exclusion. So that means that the patient presents with whatever symptoms they have, usually chronic pain, sometimes fatigue, and sometimes some muscle weakness. And they'll go about trying to figure out what is causing this. And they're going to have to rule out rheumatoid arthritis, lupus, a host of other autoimmune conditions before they can arrive at the conclusion that we pretty much ruled everything else out. Probably it's going to fall into the garbage pail diagnosis of fibromyalgia, which is very sad for those patients, because really fibromyalgia is a syndrome that has certain clinical presentation that overlaps. So most of these patients will have common tender points. So we measure the tender points. They usually have tender points along the chest wall, along the back of the head, along the upper thoracic area, along the abdomen, and along the legs. The thing is, some people will have some of these tender points anyway, whether they have fibromyalgia or not. So that, again, makes it hard to diagnose. And very rarely patients will even progress to a biopsy, where they do a peripheral biopsy of the nerve fibers. So they literally take a chunk of tissue out of your skin and they look at the nerve fibers under the microscope. And only about 50% of fibromyalgia patients will have that clinical sign. So you can't even necessarily rely on the biopsy as a diagnosis. So most patients end up not getting a biopsy. It's a painful procedure and it's not always very fruitful. So we usually go by diagnosis of exclusion, ruling out all the other autoimmune conditions that it could be in the first place. And we come to that conclusion. I believe that historically you probably heard of chronic fatigue syndrome, or some of these patients have had other diagnoses that end up being ruled out for whatever reason. And I think that the people who we used to call chronic fatigue patients ended up being these fibromyalgia patients who really do have the syndrome. And it takes years sometimes for the patients to be diagnosed. I do want to correct one thing you said about the medications for treatment. So the medications are, one of the reasons it's important to come up with a diagnosis in the first place is so we know how to treat a patient just in general. If we know what their diagnosis is and we have a better treatment plan. So of course that makes it really challenging for these patients. How do we treat them? Because they have all these symptoms that can overlap with other things. So I just want to correct one thing you said about the seizure medications. So that's used because they also help with neuropathy and nerve pain, not because those patients have seizures. They don't have seizures.
Okay,
but those medications also help them symptomatically relieve some of their pain. So that's why that's used.
So a lot of time, excuse me. So a lot of times they're giving anticonvulsants because it helps mitigate the pain.
Correct. It helps treat the neuropathy.
Neuropathy.
So it's used a lot of times. Seizure medication is used for other types of neuropathy. So,
nerve damage.
Yeah.
Nerve
So we
pain.
use a lot, like gabapentin or Lyrica, or two of those medications. A lot of these patients end up on those medications. And then the inhibitors that you referenced are a lot of times so we have, a lot of people know about serotonin reuptake inhibitors, the SSRIs, selective serotonin reuptake inhibitors. These patients tend to get depressed because it's depressing to be in chronic pain, even if they're not depressed people in general. Chronic pain will make the happiest person depressed eventually, most likely, because it's those patients unfortunately are living in a negative world because they're experiencing pain all the time. So it's challenging. So that they often end up on SSRIs, but the norepinephrine medications, which are a little bit different, but also used for depression, the norepinephrine seems to block the pain receptor. So it's not only, we use those not only for the depression, but also to treat the pain. So it blocks the pain.
So it blocks actually the signal of pain from the brain to wherever the pain is coming from,
correct.
right?
So
that's what SSRIs do, right?
Yeah. So those, the SNRIs, the N stands for norepinephrine, blocks the pain receptor as it gets into the spinal column before it can get up to the brain to register as pain for that patient. So that's why some of these medications are used to help mitigate the symptoms, but there's no real treatment. It's just mitigating symptoms.
Interesting.
And we're skating around the subject, but we didn't get to the cannabis yet.
That's where we're getting to right now.
So again, ladies and gentlemen, everyone watching, the classes of medication that are often used for these signs and symptoms are often medications that are used for other chronic conditions as well. I've seen in the hospital setting, in the pre-hospital setting, the same medication used for 4 different conditions, none of which are even related to each other. So I think one of the most common medications that you will find in an American household is going to be gabapentin. I actually get gabapentin from the VA for my peripheral neuropathy in my feet. So ladies and gentlemen, just because your doctor gives you a medication that's known to be good for one thing doesn't mean it's not good for another thing at all. And we're using a lot of terms, the SSRIs and norepinephrine. Ladies and gentlemen, these are the actual systems and proteins and compounds created within your body that produce a natural effect. So thank you so much for that breakdown, Dr. Adams. And my next question is for Chef Nico. So Chef Nico, we're getting to the good part, the cannabis. From your experience in creating these dietary supplements, what type of response have you seen once a patient who's suffering from this chronic nerve pain that's always hurting? What is, from your experience, the insertion of cannabis as a treatment modality? What are some of the outcomes that you've seen in response by the patients?
Well, it will change based off of the human. We are all separate and unique, even though we may get lump summed into average data that will produce research that could follow into average treatment. So get on your thinking caps, time to do a little food science. Let's dive into it. How do we know the unique value of each human? Anybody with a calculator, please do this and understand this. Anybody watching, this is for you. The path of logic of the human electrical mapping. Each cell has 0.04 real volts of electricity. You must multiply that by the 100 trillion cells that are in the body. I'm promoting somebody doing this on a calculator. You will find that each human body has 400 trillion volts of electricity, give or take. What that means is that a typical lightning bolt is only 300 million volts. We are some powerful, unique, individual humans, which need powerful, individual, unique, custom charting and coding to create human performance and results. Why do I say that? Because plants are electrical. They get that from fulvic mineral in the topsoil, which is the first time that electrical conductivity touches the root base. Cannabis is a plant-based electrical element. So the question comes into play on my avenue is, do you know how much electrical input you need from the food plan that you're either consistently doing or need a new one that is provided to you? Why is that important with fibromyalgia? Because when you're thinking about what's going on and we're talking about nerves, that burning, that pain, that's electrical. We have to understand that humans are all chemical and all electrical. The point is are we going to focus on organic chemistry or synthetic chemistry or a hybrid union of the two of them? This is why lifestyle and clinician space is important, because when you have a complicated digestive issue, which is what I call autoimmune diseases, being that most of the clinician space doesn't know it. But when you do data and research on not only nutrition, but plant-based electrical elements, you realize, yeah, most of these folks already have underlying situations that are going to cause issues anyway. And this causes your cells to decline instead of rapidly reproduce. So if your electrical cellular mapping from not only neurological bionutrition going all the way through your body nutrition, you're going to experience another form of dis-ease. So if we're talking about fibromyalgia, and I don't know if anybody really heard of something called right side fibromyalgia. What that means is that you can actually check to see which fibromyalgia you have. All you got to do is go 1 inch below the right side of your rib cage and 1 inch in from the center line, and you're going to touch for your gallbladder. And you're going to massage that gallbladder for about 1 minute. You start feeling pain go away, there is a sign that's showing you that this is a gallbladder situation. And now we can start understanding a looking glass on how we can give nutrition to the gallbladder, because it's sending nerves up through the right side, into the shoulder, into the neck, into the chronic, and back down into the legs. We're going to do another deep dive, but these are the steps along the way to understanding what people say cannot be done can be. You just have to look at different approaches at all points in time.
Ooh, okay. I think we might have lost a few people there when we started talking about massaging our gallbladder. Most people probably don't even know where that is. But
I don't have one anymore.
There's avenues for that as well.
But I think that what we want to kind of help us to understand, and I think maybe Dr. Adams can speak to her experience in treating patients with cannabis in particular. Once they're diagnosed with fibromyalgia, how do they determine, because New York is not a state that tests for terpenes. New York is not a state that that does a deep dive into the actual cultivar or strain of the flower. So what have you found is to be the best modalities for patients that are suffering from fibromyalgia? Is it smoking? Is it vaping? Is it a topical? What do you find in your experience has kind of helped patients the most when they are trying to manage the symptoms from fibromyalgia?
Well, demystifying cannabis. Let me just say, cannabis is such a wonderful plant, so simple to use. And I'll tell you the truth, it doesn't really, the condition doesn't dictate how the cannabis is used. The patient dictates what works best for them. So the delivery, it depends on so many variables for the patient. And really, this really applies for most conditions that people are using cannabis for. So there's a lot of overlap here for most conditions. And I really think it depends really on the circumstance of that the patient is in at that moment, and what they're trying to accomplish for their pain. And I think it's so empowering to have cannabis and have all these options. So what I try and do is educate patients so that they can treat what they have at that moment, because it always changes. So if they wake up in the morning and they're very stiff in the morning, which is very common with a fibromyalgia patient, they might want a very short acting kind of medication to treat them. So, or natural plant medicine to treat that condition at that moment. And they don't want it to last that long. So in that case, smoking cannabis might be a good way to get going, because it works. The onset of action is so quick, 30 seconds, they can start to feel it. 90 seconds, they're already good. And in 15 minutes, they're already like leveling out. So, and then maybe an hour or two later, if they wake up at 6 a.m, they don't have to be at work till 9. They can have a small amount of cannabis, if they smokable cannabis, either inhaled some way, vape, or smoking, that could work. But they don't want to be intoxicated during the day. So then they may use a higher CBD product, or they might do some kind of balance of a 1-to-1 THC to CBD. And it's about dosing. So, each individual has to customize their dose. So if it's a very small dose, they might not be intoxicated, but if they're using a small enough dose throughout the day. So they have to find what can work for them so that they can feel well. Then during the day, they might want something that's going to be longer acting. So something oral might be good, but the patient has to know their dose. That's super important, especially with oral, because trying to reach the correct dose is, you don't want to be titrating on your way to work.
Right.
Very important. And then in the evening, they might have a different need. So in the evening, they might use the sublingual tincture. When I say a tincture, like a 2-ethanol tincture under the tongue through sublingual, so it's absorbed systemically. And then they're going to get 2 to 4 hours out of that dosing method, depending on their body and their level of activity and whatever else is going on in their system. So this part of it really fits almost regardless of the condition that one is treating. That really just helping the patient find what works for them. And, a lot of times ingesting a whole plant cannabis instead of some processed cannabis, you can get a better terpene profile because you're getting the plant. So one good thing in New York is that they did come out with, most of the dispensaries do have flower that you can buy, ground flower. It says on there that it's for vaporizer use only, but
do whatever
there's nobody
you want
watching you take
right,
it, how you
right.
use it.
And ladies and gentlemen, if you have any questions for our guests, please put it in the chat, add it to your comments on whatever modality you're watching. We'd love to be able to answer your questions with our guests today. Stanley, go ahead.
So what she just broke down, everyone, is you don't just smoke every single time. Oh, I'm feeling something, I'm gonna smoke. Because I know from personal experience that patients are still productive citizens. Many of them have jobs, they still have careers. This is their tool to help them be more effective in their job. So Dr. Adams pretty much just broke down my day. I'm always in pain. My flare-ups are generally in the morning, which is when they're worse. So a lot of times I have things to do. I have webinars, I have calls to take. So taking a small amount, whether it's oral or smoking, in the morning. And I tell people, you're not doing it to the point of complete intoxication, but you're doing it to where you create enough balance for therapeutic relief. Because I know a lot of patients, that's why they don't want to use medical cannabis, because they're saying it's so strong, I get so high, I can't do anything. So learning that balance to where, yes, I may feel some of the high, but I feel more of the therapeutic effects. That's how you get your day started. And then to compile that with something oral, because as she stated, eating, dropping something, it lasts in your system a little longer. They have beverages that you can use. That will balance you out to the end of the day. When you get off work, you get home, take a shower, kick your shoes off, and that's when you want that long-term evening relief. So as she stated, that can come in several different forms. They have oral sprays, they have tincture bottles that are just drops, and as she also stated, they have sublinguals. And for those who may not know what sublingual is, that is anything that is absorbed by being placed under the tongue. And the reason we place items on the tongue, because we have a thing in our receptors in our mouth known as our oral mucosa, in which under your tongue can actually absorb things into your bloodstream a little bit faster than eating them and having them broken down in the stomach. And a quick example of that is anyone that's ever had nitroglycerin. I know we're all pretty young and healthy here, but there are people that take nitroglycerin. That is why you drop your nitro under your tongue when you're experiencing chest pain. So thank you so much for that breakdown, Dr. Adams. I'm sure that is going to help a lot of patients because I just
want to add one thing to that. A true tincture, as I said, it has to be in a water-based soluble base, because that's how it's absorbed in the oral mucosa. And a lot of times people talk about tinctures, but they really have oil drops.
Oil, yes.
Oil. An oil is really not getting absorbed onto the tongue. But you're swallowing it and it does get absorbed. It's not that it doesn't work, but it really is going through digestion, which is a very different pathway. And it
It's
takes
a
longer
process.
onset, but it also lasts longer that way. So it's not all bad. It's all good.
That's right. And Chef Nico, could you share with us some of the foods that complement the absorption of cannabis or the absorption of the medicine, and maybe some of the natural herbs that are out there that help with getting the cannabis to your endocannabinoid system?
I'm going to stick with the example that I did in the beginning. We can empower the rosemary water by adding the tincture to them. Now you've spread out your dosing in your water that you have throughout the day, and taking a few sips of that throughout each day will greatly assist in the process of mitigating some of that stress that is taking place in your body. In addition to that, there's very important support that needs to happen when we are smoking cannabis, because we have derivatives that come from this good therapy, and that is called ROS, which is radical oxygen species. And the best way to support that is with antioxidants, because that will stop oxidative stress to your cells. And when we're putting all this together, now we're creating a complete harmony with some of this therapy. So what are some antioxidants? Naturally, we all think berries, but at the end of the day, vitamin A, very strong antioxidant. People, do your research. It's a very simple thing to type in foods high in vitamin A and you get an entire list. If you don't want to do that, any green, yellow, or orange food is loaded with vitamin A. So you don't have to get so technical. You can go right back to the play school days of understanding your colors: green, yellow, and orange. Yay, now we have an antioxidant. Outside of that, we also have all of our fresh herbs, meaning rosemary being one of them. You have cilantro, you have thyme, you have parsley, you have oregano, you have tarragon. You can go on and on. Mint, basil, it never stops. All of these are antioxidants. Highly promoted that you consume them raw, meaning that you can tear them up and put them into your favorite pasta. You can tear them up and put them into a light leafy green salad, meaning watercress, or less dense green, meaning bok choy or a Swiss chard, something where the body does not have to work as much. Realistically, we're talking about pain. And we're talking about absorption. It's all about the rhythms and regulations of the body. So if you're going through pain, you want to think about what are the ways that we can put something into our digestive system and it just get absorbed. And there's many foods that go into the stomach, and the stomach doesn't have to get involved. It can just finally take a rest back and literally let some of these foods absorb into the body. Butternut squash is one of them. Oh, and it happens to be orange. So now we're touching vitamin A again. Vitamin A also fights infection. That's also assisting with your innate immune system. You see how it goes further and further into a constructive rabbit hole instead of the deep dive into, I dosed too much, I'm feeling crazy, I'm gonna have to call out. Because the thought process of us sometimes is that we need to do more with some of these plans to get more. And realistically, we need to create the rhythms and regulations to allow us to enjoy a process that we're naturally doing. We're just making sure that we're putting some education to it, and we're backing it up with some nutritional literacy.
You're muted.
Folks, he's not talking about the powdered or the dried herbs that you buy on the shelf that have been processed with things like citric acid, which
Right.
is really scary when I learned about where citric acid comes from. It does not come from citrus fruits. It actually is now being derived from black mold. So anytime you see citric acid in ingredients, well, you got to read your ingredients, folks. It's very important. Read your ingredients. When you're dealing with an autoimmune disorder, it doesn't matter if it says salt and vinegar chips. Once you read the ingredients and it says milk down there at the bottom, that's important. So you got to start reading your ingredients, because you just never know what they're putting in foods these days. And so he's talking about fresh herbs. So cut fresh herbs from your garden. You saw the fresh rosemary leaf that he had in his water. It was not powdered. It was not already grounded up and came out of a container. So it's important to, no matter where you live, if you're living in an industrial or you're living in an urban area and you don't have a farm, availability for land, they've got some really cool herb gardens that you can create right in your kitchen, that you can start growing your own herbs and using them daily in your cooking, eating them raw as much as you can.
May I just add, in the nature of talking about acid, a very important acid is malic acid. It's basically, if you were to do the research on that, it's a Latin term that basically means apple. Malic comes from a Latin derivative word that means apple. And what's the best way to get malic acid? Being that it has that tartness, apple cider vinegar. Very important to support not only your liver, but the folks that do have the gallbladder. It helps with that in dissolving stones. And this will greatly assist with any fibromyalgia that is taking place, because we are about mitigating the stress. Sometimes blocking the stress stops the mind from thinking that it's there, but realistically, it's still going somewhere in the channels of the body. And we're working on having the bile ducts inside of the gallbladder release some of that sludge. Remember, the liver, the largest organ in your body, is designed to filter all chemicals and toxins. We want to support that to start mitigating some of the stress with chronic pain. Nobody wants chronic pain.
And with apple cider vinegar, Chef, it should be diluted, right? When we're consuming it. Yes.
A very good moment to understand, because once again, you can hurt yourself horribly with apple cider vinegar. So here's a great understanding. Half a cup of warm water and the cap of apple cider vinegar. Don't measure any more than just the cap. And, production doesn't make a big cap. So it's literally one measurement. Half a cup of warm water with the cap of apple cider vinegar, and you drink that down. That will give you great liver support. That will start stimulating the bile inside of not only the liver, but the gallbladder. And this will start releasing the sludge that is inside of these organs. Very, very important. Remember, simple solution. It's cost effective, and you can do this now while other passive solutions and while you're waiting for the test results to show up to create a greater sense of human performance.
Thank you for that, Chef. A question for you, Dr. Adams. You mentioned SSRIs as a potential treatment for fibromyalgia. And the only time I've heard that term is when I was getting ready to embark on plant medicines like ayahuasca or even psilocybin. And it's something that they warn you, if you are taking SSRIs, that you should not take this natural plant medicine. Could you explain a little bit to us about where the counteraction happens and why that happens with SSRIs and these very powerful plant medicines that help with the depression, that help with getting to the other side, help with connecting with our ancestors and our spirit guides? Can you explain to us a little bit why that counteracts?
Yeah, so serotonin is a neurotransmitter, and those other plants also release serotonin. So it's really simply that you can overdose the patient. And there's something called Serotonin Syndrome, which is a systemic condition. It's not just in the head, and it increases their blood, the heart rate, the temperature. It's a serious condition with too much serotonin at once. So that is why the patient you would not want to give those strong plant-based medicines in addition to a strong pharmaceutical medicine together. It's going to be dangerous that patient could put themselves at risk for serotonin syndrome. So that's the main reason you'd want to avoid that. Those plant medicines release a lot of serotonin. We don't think that cannabis releases serotonin, so we don't really have that contraindication. Mm-hmm. The great thing about cannabis is there are very few contraindications. There are some, but even the contraindications that exist are relatively minor. And it does come into play with some conditions, especially cardiac conditions and some medications that heart patients are on. So that's important to know as from a clinical standpoint. And, most of the studies were done with smoking cannabis. So that's another thing to be aware of, that the onset of action when you inhale cannabis is very, very quick. It's very abrupt. There's a lot of changes that happen quickly in the body because the onset of action is so quick. And so just to touch upon some of the risk factors with cannabis, they are there, but it's really for distinct populations, and it's minor and it's manageable. So we can usually use cannabis. I just usually don't use smokable cannabis in heart patients for that reason, because the onset of action is so quick. But other than that, there's not a lot of contraindications with cannabis. So that's
and let me ask you this, with these studies that you've seen about smokable cannabis and maybe some of the adverse side effects, do you know if these studies have been done with just burning of cannabis, or are they considering that the patient might be burning cannabis inside of tobacco? Do you know if that distinction
Hard to
has been
say.
made?
Hard to say. Yeah, that's one of the problems with it. I mean, I'm the first one to say that it is a problem with cannabis that we can't study it for a variety of reasons. So I wish I could answer some of these questions, but it's like this whole circle of, well, you don't know because we didn't study it. Well, we didn't study it because you won't let us. So, we'll leave that one aside.
Right. Guys, before we wrap up today, wow, time has gone by so fast. This hour has just flown by. I really want to make sure that we make sure our guests tell you how you can get in touch with them. If you have questions, Dr. Adams is in New York State, practicing out in Long Island. Chef Nico it can actually treat and can take on clients from anywhere. But Dr. Adams, can you just share with us before we go what you want patients to know, what you want potential patients or anybody out there suffering from fibromyalgia, what do you want as the takeaway for today?
I think the most important thing for patients is to help them, empower them with being able to treat themselves with plant medicine definitely helps, and empower them with knowledge, and also give them hope, because they really come hopeless sometimes. It's hard to get the diagnosis, and then they find out there's really no cure for their condition. Sometimes fibromyalgia resolves spontaneously. I think the average is something like 11 years that it occasionally does spontaneously resolve for patients. We don't really understand enough about fibromyalgia, and so I always want to give them hope, whether or not their condition is a permanent condition for them. They can manage it, and they can know that they can really feel better. It's all about feeling better, and thank God it doesn't seem to cause any mortality. Excuse me. It only causes morbidity. But everybody wants to feel good. We're not here for a long time. We're here for a good time, and we want to feel good. So it's all about helping patients feel better, understanding their condition, and helping them manage it. It's very empowering for patients, and it helps mitigate that depression that sets in. That's the reason why I think patients become depressed. They're feeling terrible, and they don't know that they'll ever feel better. It's the hopelessness. You really want to give them hope, and there is hope. They can feel better, and they often do.
Thank you so much, Dr. Adams, for all the work that you do, and creating this lifestyle form of health practice. That's amazing. It's ideally what every doctor should be doing in preventive medicine, as opposed to using these synthetic drugs to just put a Band-Aid on a gushing wound. So thank you so much for all the work that you do.
It truly is my pleasure.
Thank you again. Chef Nico, could you share with us one takeaway that you want people that are listening in that are suffering from fibromyalgia, or that are caretakers of people with fibromyalgia? What would your one takeaway for today?
Would like to always inform everybody that there are solutions to everything. It all depends on where you're looking, and one that owns the technological charting system and the algorithmic codes to assist with human performance. I can inform everybody that there is a protocol, and that protocol is a 30, 60, 90-day process. When you're going through a plant-based electrical program, it's not going to be immediate. The pills will be more immediate, but it will not create the solution. The solutions are within a protocol. It's a mapping of the body and the brain. We have to support mental health to support the body. Very important to understand that. And if there are any confusions, if you need a deep dive, just head on over to chefnico.com and enjoy a free discovery call where we can set up this protocol for you, create an amazing plan that will get you to the next best level. And as a nutritional coach, I will champion all of my data and research in your direction to assist with that. It was a pleasure being on the platform with everybody.
Thank you so much. Thank you to both of our guests. I'm really excited to share with our audience that I am going to be taking on Chef Nico's plan, helping me to eradicate to allow my body to absorb HIV and herpes, both of which viruses that I've been dealing with now, and I'm so excited to get started on the program. So follow Purple Plant Magic, and you'll be able to keep up with all of the updates as we go through this 30, 60, 90, 120-day process. Yes,
I
Dr.
just want to
Adams.
mention also within New York State, if anybody does need a cannabis physician to help guide them, I do telemedicine for if you're, like New York's a big place. So if you want to reach me and you're not local, we can still connect if you're interested. Reach out to me on the website and we can set something up. Okay.
Dr. Tanya Adams.
I'm in New Jersey, so we're very close to each other. I know we experienced the same situation with the last storm, so we'll definitely have a nice conversation about this off channels. It'd be great.
Absolutely. Absolutely.
Stanley?
I'm always looking for a coach for my patients because nutrition coaching is hard. It is challenging, and we have to eat every day. So things come up all the time.
Stanley, want to close us out?
Oh, you're muted.
You're on mute. You're on mute. You're on mute. You're on mute.
I want to thank every one of our guests that's been on this week. I want to thank every patient, every caregiver, and every follower that tuned in. So a quick recap of what has happened in the last week. Welcome. This has been the Health is Wellness Week presented by Minorities for Medical Marijuana. You can go back on our YouTube pages, our Facebook pages, and rewatch these videos. Monday, we had Sickle Cell. Tuesday, we took a dive into lupus. On Wednesday, we talked about rheumatoid arthritis. Yesterday, we had an in-depth discussion regarding multiple sclerosis. And today, we closed out your Health is Wellness Week with fibromyalgia. We want to thank you again, and be sure to tune in for the M4MM M-Procure conference tomorrow. It is going to be free, our diversity conference. Tune in today at 3 o'clock for the preview show featuring our founder, Ms. Roz McCarthy, our chairman, Mr. Eric Range, and the director of our M-Procurement program, Ms. Melissa West. Again, I am your co-host, Stanley Atkins II, known as the Canamedic, and this has been the Minorities for Medical Marijuana Health is Wellness Week. Thank you all, and take care.
Take care, everybody. Thank you again.